Welcome back to Unapologetically Progressive. Today I'm going to talk about Medicare for All. Medicare for All is a great idea as I see it, and I think it's a very progressive issue that I believe most people support. I believe most Americans would support it if they knew the truth about it. So I'm going to discuss some of the high points, and maybe it'll calm some of the fears and things that people have about Medicare for All or single payer health care, as some refer to it as. Now, many out there believe that Medicare for All would cost the U.S. government way more money than it already spends on health care, while at the same time driving up taxes for the U.S. taxpayer. Based on several studies as well as research that has been done by the Congressional Budgeting Office, the CBO, this isn't true of what Medicare for All would do to the American people. In all honesty, one of the biggest reasons we do not have Medicare for All already is lobbying done by the big insurance companies to prevent it from happening. Because if all of a sudden there was a government health care plan that had no cost to the user, no copays and no premiums every month, and you get all the services done that you need, then companies like United Healthcare and Blue Cross Blue Shield would become unnecessary. And they're scared they're going to lose money. Now, so let's make one thing clear. Just because there is a single payer healthcare plan does not mean that there would not be need for other insurances, possibly for people that want insurances that cover more if they like the system we have. You could still have a single payer system, and people could still have the option to get their own private insurance. Although I do not know why they would want it, as long as Medicare for All covered everything that Americans need taken care of for their health. I do believe that health and healthcare is part of your right to life in this country. That's part of the you know part of the founding of this country. For the pursuit of life, liberty, and the pursuit of happiness. That's part of the country. That's part of what we're founded on. So let's talk about the cost the CBO report back in 2020 said about Medicare for All with no premiums to every American. The CBO said it wouldn't cost us a penny more. It wouldn't cost us a penny more than we're already spending for the terrible service that we have now, with huge deductibles that people very often can't make. They end up paying out for more of their health care every month, every year, out of pocket than they do by their insurance companies, who they can pay up thousands of dollars in healthcare premiums, which is ridiculous. Other studies like it have pointed out that possible extra taxes could be levied. But they would pale in comparison to what you pay every month in premiums and for your deductibles. Even on the ACA marketplace, there are insane levels on the deductibles: $3, $4, $5,000 depending on the one you pick. Even though new taxes were not part of what the CBO assessment had, I can understand why people would be concerned about their taxes. Nobody wants their taxes to go up. Nobody wants to be spending more money than they're already, having to spend. But this would bring down your cost, and your taxes would only go up slightly, if at all, depending on which plan you follow. The CBO says it would not be necessary. But I can understand how people would be concerned about their taxes possibly going up. My solution for this isn't to raise taxes on the working class, isn't to raise taxes on the poor. It's to raise taxes on the billionaire class, who don't need people helping them out any more than they've already been helped out. They're billionaires. They can afford to lose a little bit of extra of their money to help the rest of the society that made them billionaires. Nobody became a billionaire without the help of the working class. No one. But there have been studies showing that under a Medicare for All single payer system, the average family could see a reduction in their monthly cost by at least $1,300 a month. That's for like an average family of four. Now it could be less, you might see less savings as someone that's single because you don't spend as much money already on healthcare. But it could definitely $1,300 a month extra for a family, especially a family with kids. That can go a long ways to helping the kids and helping the parents. It would take away a lot of stress with if parents aren't having to worry about, oh my God, are we going to be able to make the health care payment this month? Oh my God, is Jimmy going to be able to go to the doctor to, when if he gets sick or breaks an arm? This is why Medicare for all would be so important and so helpful, and why every other modern country in the world has universal health care. But anyhow, if it could be cheaper for the federal government and cheaper for the taxpayer, why not provide single payer health care that covers every American for every need they have without copays and without monthly premiums? It wouldn't really make any sense not to, would it? It seems like it'd be a really good idea to save money for the American taxpayer and the federal government itself. Because if the federal government's saving money, it's saving you money. Also, if we had to raise taxes, we could literally do a 1% tax on the top 1% of this country. They would never notice it was missing out of their account because they have so much money to begin with. That's even if we needed to raise extra funds to cover the cost of the program. But the CBO says it wouldn't cost us any extra money than we're already spending, so we wouldn't have to worry about that unless they keep cutting taxes for the billionaire class who don't need the tax cuts. In the past, Bernie Sanders and others have brought forth legislation calling for Medicare for all. And there were ways we could bring down the cost within the system as well without hurting the patient's care or the payment to the doctors. Because doctors have gone to school for a very long time, they've spent a lot of money to become a doctor, and I believe they do deserve to be recouping some of that cost. Some of them still have student loans to pay. And so I completely understand the fears they would have about not getting paid. And so we got to make sure that whatever we do still keeps doctors paid and hospitals functional. And so that's definitely a thing we have to keep in mind. And that's what the CBO plan had in mind, and that's what the Bernie Sanders Medicare for All plan had in mind. But there are ways. One of the many ways that was put forth by Bernie Sanders and other progressives has been to allow Medicare to negotiate prices for medications with drug manufacturers. At this point in time, they're not able to do that, so it kind of creates a problem for the government programs that are trying to keep costs down. By allowing this, Medicare would be able to bring down the cost of drugs, thus saving money for the system and preventing the need for copays for those prescriptions. Because like right here in Oklahoma, I have a Medicaid plan from Sooner Care through Aetna. It's through Aetna Better Health, but on my prescriptions, I have anywhere from a $5 to $10 or even more copay, depending on the cost of the drugs. Now, I'm not one to take medication very often. I don't like taking medication, but one thing that's going to keep me from doing that is paying the copays because I don't always have extra cash lying around. I have to be able to eat and pay rent. The only thing, though, that I believe needs to be added to Medicare for All and needs to be made a guarantee is that no patient can be denied cancer treatment when deemed necessary by their medical team. I believe if a doctor says cancer treatment is necessary, chemotherapy, surgery, whatever, I believe Medicare for All should have to cover it 100%. No cost to you, no cost to anybody else. That's just my belief. I don't believe cancer treatment should ever be denied. I can understand requiring people to get a second opinion to make sure that it is necessary. That's only a reasonable medical due diligence, I believe. But I don't believe anybody should go without cancer treatment, especially if it's just because they don't have any money. That's not reasonable in the richest world, or the richest government in the world, to not provide that. And I know this is part of the intent of Medicare for All. I know Bernie Sanders has talked about it over and over again as being a very important part of Medicare for All, but I want to make sure it's written into the law if it's ever made, and made a guarantee that cancer treatments will not be denied, because nobody deserves to die or go bankrupt because they got cancer. It's just not reasonable. And it just needs to be explicitly clear so it's not confused by anybody that it doesn't cover it for any reason. We don't need that happening. We don't need it to be any confusion. We need it laid out in clear terms. Because, like I said, nobody in America should lose their life due to a treatable cancer. And no American should have to go bankrupt for doing it, for surviving cancer either. But but that's not the only thing we're up against here, right? You can see how the billionaire class would see this, right? They would see it as taking money from them, and that's why they spend millions, if not billions, every year lobbying against Medicare for All, lobbying against Medicare being able to negotiate drug prices, and the list goes on. You think about it, or when you think about it anyway, a company like United Healthcare is denying 80% of all treatments, many of them being cancer treatments deemed necessary by a doctor, even by people that have had second, third, and fourth opinions. And so it's definitely not good, right? The things that are happening with healthcare. But they say it's not cost effective, it's not reasonable, it's not necessary. Yet they spend millions of dollars, if not billions of dollars a year, lobbying Congress to stop the idea of Medicare for all. And that's money they could be using to save the lives of Americans, and they're refusing to do it. They won't bring down the cost. They will not pay for people's cancer treatments, and they're not paying for people's other needs like insulin. But it's nothing new. The American billionaire class has never been about saving Americans or helping Americans. The billionaire class is out there to make as much money as they can, regardless of the outcome for you or me. The billionaire class does not care that you're poor. The billionaire class does not care that you're in the working class, busting your ass every week and still trying to figure out how you're going to afford groceries for your family. This is one of the reasons that we have such low birth rates in America. It's not because people hate children, because people don't want to have kids. I had a dream at one point to have a kid myself, but finances never made it a viable option. Not to mention my physical issues. But if people have to worry about health care and they can't afford health care for themselves, how are they going to afford to bring in a child into the world, into a country where we're constantly cutting children's Medicaid programs to begin with? And people just they don't understand. A lot of people don't seem to understand that. They don't seem to understand that the billionaire class doesn't care about you, and the billionaires are the ones that run the healthcare programs. The healthcare industry. Had it said to me a long time ago, and it makes a lot of sense, that the healthcare companies aren't in it to get you healthy. The healthcare industry is in it to get your money. That's the reason they want you to pay these exorbitant fees, right? And it's why some hospitals want you to go through all these different tests that are absolutely unnecessary. Because the people that own the hospitals, that own the healthcare insurance companies, they just want your money. That's all they want. And the whole system needs to be reconfigured. We need Medicare for all, that way everybody can get health care in this country, from the moment they're born to the moment they die. And it just makes sense. I believe Medicare for all is the solution to our current medical system failures. We need a system that works for the poor and the working class and doesn't just line the pockets of the billionaire class. And that is the one thing that I can't stand, is the fact that we do all this, we spend all this money. We make these people as rich as humanly possible. Meanwhile, they don't give a rat's ass what we're doing, what we're dealing with. All they care about is if they can make more money. The billionaire class is not your friend. It is not our friend. It never has been and never will be. The times that we had some of the best healthcare in this country and some of the best outcomes in this country was when taxes on the billionaires were up around 70%. And I'm not even suggesting that. But if we could get them anywhere near what everyone else pays in this country without being able to cut their taxes, we'd be a lot better country. We'd be able to afford Medicare for all with all the bells and whistles of a Cadillac private health insurance plan. All we'd have to do is increase taxes on the top 1% by roughly 1% of their annual income. And as it is, we could run a basic healthcare system for every American that gets everything taken care of, you know, minus your cosmetic surgeries and things like that, that are personal choices. They'd be covered. And you could have private insurance for those other things. The other things that you may want health care for. Maybe there could be plans out there that help cover cosmetic surgeries and things like that. I don't know. But I know people aren't having their basic health care needs met in this country. And it's really causing a problem for the working class and poor. It's almost impossible for the working class to be able to afford, they bust their ass and they make too much money to get subsidies from the ACA, but they don't work, they work so much that they don't qualify for ACA subsidies, but they don't make enough to pay for insurance for their families. They don't make enough to pay rent. They don't make enough to put food on the table and cover a $2,000 to $3,000 a month insurance bill that they're not getting anything out of. Because if you're paying $1,500 to $1,200 a month or $2,000 a month on insurance, and your deductible is $6,000 for the year, are you ever going to meet that deductible outside of something absolutely catastrophic happening? No, you're not. And so Medicare for all is the solution for the problem. And I believe, if anything, what happened a few weeks ago to that CEO, as heinous as it was, pointed out that there are true failings within our system and how the private healthcare system is not working for most Americans. It is working for the well-off because they're lining their pockets with it. Thank you for watching. Come back to Unapologetically Progressive for progressive news. We are a home for progressives.